So the causes of concealed hemorrhage are intact membranes, seepage into the amniotic cavity, and head in the lower uterine segment. So what happened? The margins are intact here. There is a blood is separated in between the uterine cavity and the placenta, and because of the separation of the membranes, and there will be head in the lower segment. So it may not come out completely, but there is a hemorrhage inside the uterine cavity. మరి ఏమిది కరెంట్ అయితే రాదా?
కంటిన్యూ చేయండి. కరెంట్
The etiology, high birth order, that means the abruption is very common in a multigravida where she has given many births, and advanced age. The woman usually who has become pregnant after 30 years of age, there are more chances of abruption. And multiple pregnancies where there is a distended uterus, where there is a chances of abruption is very common in the, or we can see in many number of multiple pregnancies is abruptio placenta. PPR, premature rupture of the membranes. In these cases also the abruption is very common. And familial, sometimes the abruption can is the familial. And hypertensive disorders, especially hypertension, chronic hypertension, in these cases the abruption is very common. And the pregnant woman who smokes more, or who are addicted for cocaine and all abuse, these cases the abruption is very common. And trauma is also one of the cause for abruptio placenta. And sudden uterine decompression like hydramnios, where there is a sudden rupture of the membranes, where there is a negative pressure which may cause bleeding in the internally, and short cord during the process of labor. Whenever there is when the fetus starts descending down, there is a possibility of the abruption. Supine hypotension syndrome, there is a pressure on the aorta because of the gravid uterus. Sometimes it may lead to abruptio placenta. Torsion of the uterus, whenever there is a uterus is deviated from the normal position, there is a torsion, there is a possibility of the transfer, there are likely chances of going into abruptio placenta. There are uterine anomalies. Usually, whenever there is a uterine anomalies, we can expect some complications like abruptio placenta and PROM, and also premature rupture of the membranes and preterm deliveries. A submucous fibroid, in such, whenever there is a submucosal fibroid, which is one of the cause for a abruptio placenta. Whenever there is a folic acid, vitamin deficiencies like folic acid deficiency may lead to abruptio placenta. And there is a thrombophilias, whenever there is a coagulation defect, there are likely chances of abruptio placenta. And once the woman had an abruption, there are many chances of again they will have a recurrent abruption. These are the etiological factors for the abruptio placenta. And pathogenicity, coming to the vasospasm in the placental vessels, which may lead to ischemia of the vessel wall and the leakage of the blood, and there is a retroperitoneal hematoma, there is a separation of the placenta. This is the pathogenicity of abruptio placenta. In a few cases, sometimes they may not be able to have any clinical features, and diagnosis can be done only after delivery, after the examination of the placenta. Usually in all the normal cases, it's a routine to examine the placenta after the delivery by keeping the placenta in our both hands, and see for the membranes and cotyledons which are intact or not, and any blood clots are there in the uterine surface. All those things we have to observe. When you observe in the case of abruptio placenta, we can see the blood clots that is on the maternal surface, maternal side of the placenta. In all cases, bleeding is almost always maternal because of the rupture of the vessels that can occur in deciduous basalis except when the placental tear occurs. There is a phase grading of the abruptio placenta. Grade 1 diagnosis is made only after delivery, where the patient doesn't have any signs and symptoms of abruptio placenta. Whenever in a grade 1 placenta, there is a mild vaginal bleeding will be there, and there is no fetal distress. There is no signs of any fetal distress, and the uterus is just irritable. It is not tender. Our maternal condition is very stable. In grade 2 pages grading of classification, there is a moderate, it is called a moderate abruptio placenta, where there is a distress, that means evidence of fetal heart variations, and there is a meconium stent like all these things will be there in a case of grade 2 placenta. Tenderness is always present when you keep the hand on the uterus, and there is increased pulse and BP will be stable, and there is no signs and symptoms of shock. In severe grading, grade 3 is called a severe grade of Peck's grading of the abruptio placenta, where we can see the fetal death is a rule. So because of the more severe blood loss in the inside the uterine cavity, there is more chances of fetal death, and we can see that there is a tenderness. The woman may not able to allow you to just up the uterus, and there is signs and symptoms of shock will be there, and there is sometimes there may be coagulation defects also can be noticed. These are the grading of the abruptio placenta. The complications of abruption is the maternal shock and disseminated intravascular coagulation, acute kidney infarction, and there is a quivillary uterus. What is quivillary uterus? This is very important clinical finding you should know in the case of severe abruptio placenta. There is because of the quivillary uterus means when you examine the case during the cesarean section, we can see that the whole of the uterus is distended, extravacation of blood into the myometrium. We can see there is variations in the color of the uterus. In severe forms up to serous coat, we can see the extravacation of the blood not only in the myometrium and also to the serosal level. Free blood may be present in the peritoneal cavity, very rarely in broad ligament and to the substance of the ovary also. This is quivillary uterus. As a short note for you, this quivillary uterus may not respond to your oxytocin because of because of the extravacation of the blood. Mostly diagnosis and the laparotomy, but cannot be clinically. If it can be clinically suspected if there is a severe uterine tetany, there is a continuous contraction of the uterus and the severe tenderness when you touch the abdomen or keep the hand in the uterine cavity, the uterus is unresponsive of the uterus to the oxytocin drip. Usually a term uterus, it is very sensitive to oxytocin drip. But if you suspect any quivillary uterus, this uterus may not respond to the oxytocin drip, and no improvement of the patient in spite of your blood transfusion. That is the evidence of diagnosis of quivillary uterus. See, there is if you see the naked eye appearances, we can see the uterus is dark port wine in color. Whole of this is dark port wine in color. Initially on the cornule, we can see, and later on it is spreading to the other area, especially over the placental side, we can see more of the darkness. So the uterus is lost its pink color, which was there previously. In quivillary uterus, the blood in the myometrium does not interfere with the uterine contractions following delivery. So in quivillary uterus, the blood in the myometrium does not interfere in the uterine contractions following delivery. So presence of quivillary uterus is not an indication for hysterectomy. You should not do the hysterectomy in this patient. Slowly the blood will be absorbed, the uterus may become normal after a few days or few months after delivery. Conjunctive coagulopathy. There is a consumption of fibrinogen in the retroplacental bleed and the DIC. So whole of the fibrinogen will be utilized for the formation of the clot. The DIC occurs due to release of the thromboplastic material from the damaged decidua and chorion, which results in decrease in the fibrinogen levels, increase in the fibrinogen degradation products and D-dimers. So this is the map. You can see that starting it is the balance of the coagulation precipitating event and tissue factor release of the coagulation cascade. You can see excessive thrombin that is released because of the whole of the thrombin is used by conversion of the plasmogen into plasmin, which again will make the fibrinosis with excessive FDPs. Here we can see the microvascular and there's a clotting thrombocytopenia because of the utilization of the blood components, and there is a macrovascular clotting and consumption of the clotting factors. There is excessive clotting will be there that may lead to ischemia and impaired oxygen perfusion. There is end organ damage. Because of this fibrinolysis, there is excessive bleeding. The woman may go into shock and hypertension and increased vascular permeability. This is the coagulation process that can occur in a case of abruption. Significance of conjunctive coagulopathy: there is a bleeding tendency, consumption of clotting factors, there is anticoagulant effects of fibrinogen degradation products, and the organ hypoperfusion, and there is a microangiopathic hemolysis can occur. So acute renal cortical necrosis can occur. This is one of the complications of abruptio placenta, where there is impaired renal perfusion due to massive hemorrhage, and the preeclampsia also will be aggravates, and proteinuria due to renal anoxia disappears in 1 or 2 days. Sometimes there is a rarely Sheehan syndrome can occur because of the hypoperfusion to the brain tissue, anterior pituitary necrosis, that is called Sheehan syndrome, where there is a failure of lactation. The woman may go into amenorrhea. There is a breast atrophy, and the loss of pubic and axillary hair, and hypothyroidism and adrenal cortical insufficiency can occur because of the hypoperfusion to the brain. So now we can come to the management part of that abruptio. It depends on the gestational age of the fetus and maternal and fetal condition. The prognosis depends on the degree of the separation of the placenta, and also the rate of separation, and the early diagnosis and prompt treatment in time. And delivery is one of the important management of the abruptio placenta. The causes and predisposing factors are because abnormal placenta and the injuries during labor, and defective uterine action, and small maternal blood volume and coagulation disorders. So this is about the abruptio placenta. Student, today only you go and read about the abruptio placenta, which is one of the most important complications that can occur in the later trimester, and also during labor also it can occur. Okay, then I will give some time for you to ask any questions regarding this abruptio. Thank you very much.